Welcome back to another episode of Dentistry's Growing with Grace podcast. Join Grace and her guest of the week as they discuss lessons learned in the industry and explore unique insights into ethical growth.
Hello, welcome back to Dentistry's Growing with Grace. I'm here with my friend, Greg Schubert. Greg, thank you for joining me.
Sure, Grace. Glad to be here today. Nice to meet you.
Nice to meet you too. And I know we spoke a little bit about your philosophy and care as a lab leader in lab work and with ProCraft Dental Lab. But let's tell our audience a little bit about you and your history in dentistry.
Sure. Well, I started the lab and I was renting a house from my dad at the time, and we started it in the garage, like a lot of laboratories. And that was in 1979. And bringing us all the way up today, we are family owned and operated. My he's 30 now, and he's been working with me since he was 15. And he handles all the digital stuff and all of the complicated digital stuff. I'm a ceramics technician. I like to build ceramics and work on the art side. And my son Dylan, he takes care of all of the digital and the technique stuff. And then I've got my brother here that's been working with me since, I believe, 93, and he handles all of our sales. And then my two daughters, they help me with all the marketing stuff. Fortunately, I'm very fortunate that all my kids, I got 4 children, and they all live right around here. They have homes in the neighborhood, and so we're all closely knit, and we're very much involved in the dental laboratory. They've grown up in the dental laboratory business, so it's nice to have them involved in the business also. So we're definitely family owned and operated. We don't offshore anything. Everything's done here in-house in the laboratory. We moved the laboratory here to Murrieta, where we live in Murrieta, California. And we moved into this building in 2005. It's state of the art. It's a beautiful facility. We did all the tenant improvements, so I like to make things just the way I want them. So the laboratory turned out well. And yeah, we specialize in high-end aesthetic anteriors, complex implant cases like the all-on-4 that we'll be talking about. And we're full service, so we do a lot of precision partials and premium removal products. So that's kind of a little bit about us. One other thing I'd add is I come from the boutique lab world, where it was very high price for back in that time. We were getting paid extremely good money for a posterior, okay, or whatever crown we're doing. But I found that there's not a lot of dentists that can afford that type of work, or patients for that matter. So we've managed to do over the years is figure out a way to take those boutique things that we used to like to do and put them into a system that allows us to be able to do it at a much more reasonable price and not give up those boutique elements of aesthetics and art. So that's really kind of makes us different is the system that we have that breaks all of that detail down into little steps, and we'll have one technician just do one step and get really good at it, and then it goes on down the line. So we've been really successful at doing that, and that's a little background about us.
I love it. I can relate to that a lot. We build websites, and we have about 100 steps in building a website. And anytime a little hiccup happens, I go, do we have a step for that? Is that in the process?
Yeah.
What process failed? What can we fix? Because I always tell my team, like, we can, the first time something happens, it's a learning experience. The second time it happens, it's a mistake. And so you're constantly creating and recreating systems to minimize the occurrence of any hiccups. And I think too many service-based businesses don't put enough effort into their step-by-step processes and their accountability and their training, and they grow too quickly. And when you outgrow what you can serve, when you outgrow your systems and the support that you have, you compromise your reputation. And once that's shot, you got nothing. So
yeah, you got nothing. You have to do something right. I mean, we would have been in business for a long time. And I found out early that a lot of that just has to do with always thinking of the customer. You have to think of the customer. And if you keep the customer happy, then you stay in business for a long time. So you and I think a lot the same. As you're speaking, it's ringing true to me. You'd be a great dental technician.
Thank you. Thank you. Well, and I'm going to get to these technical questions that will certainly bring value to our dentists that are listening. Before I do that, I want to just talk as a patient, and I want to tell our listeners, you're the lab that you partner with it matters a great deal. If you are not with someone who is reliable and provides quality work to you to then deliver to the patient, it compromises your relationship. And I think too often dentists are solely price shopping for who they partner with for their lab. And I can tell you right now, I'm a patient and I'm a good patient. I have 10 veneers and a whole bunch of restorations all over my mouth. And I could tell you, I recently had a veneer break, and I brought the actual veneer into my dentist and I said, we need to replace this. And it's kind of far in the back. But I said, you know, here, you have this, send it to the lab. And when it came back, it wasn't the same shade. It was brighter. You don't want a tooth in the back brighter than the teeth in the front. And
Right.
I ended up having to have four appointments of, you know, all of this, a lot of chair time, a lot of billable hours away from my business to fix this one tooth.
Sure.
And now I have another one that cracked. I told you I'm really good at being a patient. And I'm like, I love my dentist. I love her, but I don't want to go through that again. I really
Right.
would rather know that they're partnering with the best lab, and it is a reason for patients to leave. So before we get into the technical benefits and values that we're going to share with our audience today, I just, from a marketing perspective, dentists, pay attention here, because this, what you provide every step from the very first phone call to post-op instructions, every bit of that patient experience contributes to your marketing, your new patient acquisition, your brand and reputation, and it all matters. So when you're considering who you're going to, you know, partner with, these are some things to consider, especially from ProCraft. So that being said, now we'll get into the meat of things. Tell me a little bit about the thickness. What's the required final thickness of the zirconia prosthesis? And I'm not a clinical person, so if I say something
You're
wrong,
talking.
forgive me.
Yeah, no worries. Yeah, you're talking about the all-on-4. That's some of the complex implants cases that we do. One of the biggest challenges is making sure we have the proper thickness for strength. And that thickness should be between 12 and 15 millimeters minimum. And that's from the crest of the ridge to the incisal edge of the prosthesis. That's a must. It has to happen, or otherwise you'll get breakage. Zirconia does break, despite what people will tell you. I'm sure we all know that now, although that's the way it was pitched early on. One of the ways to get that thickness for the restoration is, of course, bone reduction is the first choice. This is a surgery type of restoration. The bone needs to be reduced, and that's the first choice. And one of the main reasons for that is strength, but also for the ridge. Underneath the ridge, it can't be convex. It can't be concave. It has to be convex, and that's for cleansability. Patient has to be able to get underneath there and clean, so they have proper hygiene. And so bone reduction aids in that, because it doesn't turn into a ridge lap type of situation. We can make it nice and cleansable and clean. Sometimes that minimum thickness can be achieved by opening the vertical a little bit. So if the patient can tolerate it, the vertical can be opened, of course, and you can attain that thickness. So that's kind of a fallback position to be in. Bottom line, though, if you get down to where you're less than 12 millimeters of thickness, a titanium bar would be the way to go. It's a substructure that we built inside of that zirconia. And of course, these are full mouth restorations. It's a full upper arch. So that titanium bar would be placed in there to add that additional strength if it starts to get down to that thickness. Of course, that is more complicated. It requires more steps and more expense. So bone reduction is the first choice to be able to solve that problem. And that gets you to that thickness that you're looking for.
Interesting. And I know every dentist I work with has a different philosophy in care and treatment planning and process. And it's important that your lab partnership, that you have similar, maybe I'm wrong, but that you have a similar philosophy in treatment. Otherwise, it's just going to create, I think, a lot of friction and miscommunication unnecessarily.
Absolutely. Yeah, absolutely. The communication between the lab and the dentist is always like paramount, especially when you're talking about anterior aesthetics and something as complicated as implant cases. They got to be on the same page. You got to the lab technician is going to work with a lot of different clients, and each client might have a different approach or a different philosophy about how to do something. So the laboratory needs to adapt to whatever that clinician wants. And so we do things a lot of different ways sometimes, and maybe not all the time in a way that we think it should be done. But the clinician calls the shots, and so we have to adapt to the way that they want things done in general.
Absolutely. Absolutely. Well, the interesting thing is, like, when you're working with a dentist, a lot of times they have the perspective of one practice, one set of patients, and maybe not a whole lot of history there. Whereas when you're a lab, or like us, a marketing agency, we've worked with, thousands of practices. And so we can see trends, and we can see, okay, well, this broke. Well, we start to see why. You start to see on a deeper level, because you have more practices to compare it to. So I think it's helpful to hear this, clinical input from yourself, that you've been in business. How long have you been in business?
Oh, 1979, it's like over 40 years, 42, 43 years, something like that. Longer than I want to admit.
You've seen trends from more than one practice, that's for sure.
Yeah.
So you
Yes,
have a
that's
different perspective. And I think, not that you would ever dictate the process, but if you do have a clinician who wants your opinion on longevity, I'm sure there's a lot of communication and opportunity for communication there as well.
Yeah, there has to be. One thing I've noticed, that with the advent of technology changing so much, that nowadays the dentist more and more relies on the lab in order to help them with that. There's just too much information, too much technique, too many materials. So it's up to the lab to step up. I mean, really, honestly, the dental lab profession needs to step up, provide, and fill in that gap for the dentist. If you're thinking about the patient as the ultimate customer here, which is who they are. For us, of course, the clinician is our customer, but ultimately it's the patient. So we'll try and move our clinicians in the direction that we think that they should go to serve the patient, because ultimately that's who we're really concerned about. And that's just kind of our philosophy. So we work in that direction.
I think sometimes, and I promise I'll get back to my technical questions, but I think sometimes doctors think that if they take their time, that's always a good thing. And as a patient, I don't want 4 visits if I could have 2 visits. I don't see value in you taking more time to restore my tooth if you could do it in less time. And so getting it right, getting the impressions right, getting the process right from the beginning saves the patient time, and they do care about that a great deal. So that being said, how can you eliminate the titanium housings from, becoming loose or needing to be rebonded?
Yeah, that's a real issue. We take all the precautions when we're doing all on 4s. We sandblast. We use a product from Bisco called Z Prime Plus to prime and prepare the surfaces, and we follow all the bonding processes. But the fact of the matter is, if those all on 4s have been in the mouth for a period of time, sometimes they can torque loose just from the movement in the mouth. They torque loose, and so on occasion, the clinicians having to rebond those back in, or they send it to the laboratory to do it. And one way to eliminate that whole factor is, again, with a titanium bar. The titanium bar is the advent of 5-axis milling that's in the business now, and some of the higher end milling systems. We're able to mill these bars that will precision fit inside of the zirconia to add that extra strength. Well, of course, we use it for strength on a regular basis, but it eliminates the housings popping out, because you don't have any housings any longer. So you kind of accomplish 2 things at once. I don't know what percentage the housings come out. We just see it. I know that we see it, every few months or so, one will come back in that some of the housings, they've been in there for 2 years or something like that, and the housings work loose. So we know also that the titanium bar is an extra expense. But that is one way to eliminate the possibility of that happening, and kind of kills 2 birds with 1 stone. You can take care of the strength issue if you have it, and you'll never see that housing come back that's been delaminated. So that's one way we would do it.
And listen, there might be a little bit more expense, but if I'm replacing my teeth as a patient, I want the longest lasting, absolute best option. And
Sure.
most of the people who call me when they're looking to, attract more implant patients and things of this
Mhm.
nature, I'm always teaching them, you're either marketing to people who are looking for the cheapest, or you're marketing to people who are looking for the best.
Yeah.
Don't you dare market yourself as the best and then provide the cheapest. You need to have brand consistency here. So
I think along with that, I think that one thing that the clinicians can consider, and it's kind of the clients that we attract just by the nature of the beast, is they're interested in the reputation. They have a geographic area that they do business in, and the reputation is paramount in that area. But oftentimes they'll send their posteriors to a less expensive lab, and their anteriors, which is what we specialize in, to a little bit more expensive lab. But my opinion's always been that when they go home and they had a bad experience with a posterior, they're going to complain just as much about it as if they had a bad experience with an anterior. So are they really saving a few bucks when you consider the reputation on that posterior? Of course, we like to do posteriors, and we like to do more of them, but that is a trend that we see, that posteriors are sometimes sent to labs that are offshore or less expensive labs, and I don't think that it does a justice to them if they're trying to improve their reputation and maintain the reputation in their area. So.
No, certainly not. And I do see this a lot in marketing, that we use the best materials, the most like, don't just say it. You have to live your brand. You mentioned about, bone removal.
Mm-hmm.
How do you know how much needs to be removed to get that desired vertical?
Yeah, generally it's going to be somewhere between 11 to 15 millimeters per arch to get that reduction that you need, generally speaking. One way that the clinician can know that they're getting the proper bone reduction is a good lab is going to go ahead and make a duplicate denture or a immediate denture, and that the flange is going to be designed differently. It's going to be designed straight across, and it'll be designed at the proper thickness that end prosthetic should be. And so they can put that in the mouth, and this is during the surgery steps, and they can take a carbide or a diamond burr, and they'll go ahead and they'll trace into the bone or into the tissue a line right across where that measurement needs to be. And then as they're reducing the bone, they get down to that level, and then they know that they're at the proper level to get that thickness of zirconia and have that bone reduced. Another way would be some labs will provide an acrylic jig that can be placed over the ridge, and it's kind of like a reduction coping, and the clinicians will know what that is, and they can just prep the bone off even with that to get to that area. But getting that's probably the biggest challenge we have. It's probably the number one thing is bone reduction. All of ours have become very popular, but they require a certain approach to deliver a good product that's hygienic and that's strong. And so you got to have that bone reduction in order to handle that. And it's more difficult to do on the maxilla than it is on the mandible. The maxilla, you have to reduce enough so when that person's in a broad smile, that they don't see the edge of the zirconia right there.
Yeah.
So as you're reducing that bone, you got to go up enough so that in the broad smile, you don't see that finish line. And that all comes down to pre-planning and knowing all of those things before you even start the case. So you have it done correct when the patient's there, and you get it done in one time. So that's probably where I see the biggest challenge is bone reduction. There are products. We do a product that's all milled out of chrome, and individual teeth are put on preps. And what that does is it allows us to make the prosthetic very thin and narrow. All right, because it's chrome, it's not zirconia, so the strength is there. And that helps you cheat a little bit, where you don't end up having a concave underneath the ridge, because it's so narrow that you can get rid of some of that concavity. But now you're talking about, real expense. It's really high end when you're making all that chrome framework and individual crowns to put on there. But we do them, and it's a method to get away from that, having an area that's not hygienic, and maybe you don't have the correct vertical you want,
Yeah.
So.
And I want to speak to this too. Dentists, listen, not every patient wants the cheapest option. Don't assume this. You can have different levels of restoration, of smile replacement. You can educate your patients on different materials and expected longevity and the benefits of these things. You can make it a system where you allow them to upgrade to something else. And they will appreciate the time that you spent in educating them, not the time in the chair. They don't want to be in the chair, but the time that you spend educating them and giving them options. They will feel like you're providing next level care. So don't write it off because it's a little more costly, and don't make that decision for your patient, because some patients, like I said, they want the best, some want the cheapest, and there's not always a whole lot in between. So make sure you consider who you're talking to and who you're presenting treatment to. And that kind of brings me to my next question too. We talked earlier, you mentioned, fractures potentially. How do you reduce the possibility of a fracture in a zirconia prosthesis?
Well, we talked about the thickness of the zirconia as one aspect, but there's also when you have too much of an extension, where there's a distance between the implants that are placed, or they want to go too far distal past that last implant, and you end up with this extension. A good rule of thumb is you only want to extend on the distal extension. You only want to extend about one tooth past that last abutment, as a general rule. Anything further than that, of course, you're cantilevering that zirconia out. And if you think about it, there's an implant right there in front of that extension, and that's where all your zirconia is thinnest. And we'll see them where they just cantilever down, and it cracks right there with that last implant, and you're back to remaking it again. So you can't extend too far. And then also, again, if you need to, or you feel inclined to, again, the titanium bar is what goes in there to fill that. And so you could extend it back. We know that sometimes the patient, when they smile, they don't want to see no teeth back there, right? So they might, they're going to encourage you to extend one more tooth back so that it's aesthetic and they don't see it when they have a broad smile. Well, you're going to have to tell them, hey, you're going to have to move to a titanium bar underneath there to give you the extra strength. And then you can kind of get back a little bit further, maybe in another tooth or so. So those are just some general rules of thumb. Again, but with the advent of the titanium bar, we just see that being used more and more as this whole technology has kind of blossomed and grown, and we've kind of taken our hits, along the way, and learned, hey, look, this stuff is not bulletproof. It will break, even though it's really thick, it'll break, and you have to handle it with respect. So that's how we handle the long extension issue.
Yeah, that's really helpful, and I'm sure our listeners will find it helpful as well. I always think about these all on 4, all on 6, all on X, whatever it ends up being, and thinking about how challenging this must be, especially from a patient's perspective, because it's the only perspective I really have. And I think about the aesthetics of this, and you sometimes see people I see people out in the world that I can tell they have dentures, or I can tell they have a dental prosthesis of some kind, an all on X case. So how can we make sure that with each patient that these all on X cases are customized to them?
Right. Sure. Yeah, that's kind of a two-part question in that sometimes it's not the clinician's fault or the laboratory's fault. It's the patient's fault. They want these perfectly straight teeth, and they want them all to be a bleach shade. And in my opinion, that looks like a denture. So it just kind of depends on the patient. There's a way to approach things where if the dentist is doing the wax try-in, for example, on these all on 4 cases, they can encourage the patient to kind of move some teeth a certain way. Nothing drastic, but just something that's nice and subtle that lends that natural appearance to them. And luckily, as opposed to with a denture where you really only have a tooth that is all the same shade, with all on 4s, we can subtly change the shade throughout the tooth so that the gingival area is a little bit different color than the incisal, for example. And then you got embrasure areas that you can put slightly shading in. Nothing that's offensive, but when you look at it, you wonder, okay, is that a real tooth, or is that a prosthetic? You know what I mean? So that's kind of the magic of dental technicians, is we go in there trying to figure out, well, how do we make this thing so that the patient likes it, but it doesn't look like it's a fake anterior bridge or whatever it is that we're doing. And I think we do a good job doing that, but you have to have a clinician that's interested in kind of educating the patient sometimes and letting them know, hey, look, you got 2 ways to go here. And then ultimately the patient makes the decision, and we do our very best to make them look like natural teeth irregardless.
Absolutely. And
one last thing I'd add on that I almost forgot is photos. we're big on photos. That's how we can personalize it to the individual patient. We need to see their face. And so we need to have like a full face photo of them in a broad smile. We need to have a photo that's taken of up close of just the maybe the wax try-in in an all-on-4 situation, so we can see how the wax try-in is laying out. And that's straight on. And then from right and left side, it's slightly an angle, so we can see it from that side of the wax try-in. And then the last photo would be like totally on the side, so we could see the overjet of the maxilla and the mandible, so we can kind of see how that looks in the patient's mouth. Photos, man, if there's one skill that the dentist can learn, it's easy nowadays because we have all this technology, is to send the laboratory really good quality photos. And then that helps us. We can see the patient. We could see how their nose might move to one side, or when they smile, how much gum is showing or how much is not showing. It's like they say, picture says 1,000 words, right?
Yeah. And that's the artistic side of what you do, and why you want to partner with a lab that takes interest in that end result, just like you do. And I just think there's such an incredible benefit in finding the right lab to partner with, and learning how to work together, learning how to communicate, and making sure that it's as seamless as possible for the patient, because at the end of the day, that's your reputation on the line. So Greg, thank you so much for being here with me today. If one of our listening dentists wants to learn more about your lab, how can they get in touch with you?
They can just call me direct at 877-484-3522, or they can email us at info@pro-craft.com. Got a great team of people here, and kind of our motto is we don't make crowns, we make teeth.
And as a marketing nerd, I absolutely love that. I really do. So to our audience, thank you for listening. Join our Facebook group, Dentistry is Growing with Grace. Follow us on YouTube, where we post our full episodes. And I look forward to seeing you next time, where we'll share more great information. Thank you, Greg.
Nice meeting everybody. Have a good day.